funny because a lot of people in global development who I come across tend to say, well, human-centered design, that's just good development. And they don't necessarily think they need to use this approach. How do you make the pitch that actually they need to kind of evaluate how this approach might work within their own organizations?
I mean, first I think it's important to recognize that it is good development, and I think that there have been many people that have incorporated human-centered design approaches into participatory development for decades, and so in some ways they're right that it's not actually new. I think what we see is that it's not universally done in this way, right? And so though people sort of know that it is best practice to engage the community, it's oftentimes a step that just gets neglected in the rush to put together a proposal or to get a new project started. And so I think we work to sort of emphasize the importance of it, but also to really emphasize the importance of not just connecting with users and asking them questions at the beginning, but really prototyping approaches with them early on. And so we oftentimes talk about how much time and money can be saved by putting ideas out there earlier in a less final way as a prototype to get feedback so that they can fail sooner and ultimately we can get to the right solution.
I know that IDEO has done a lot to, I would say, almost open source human-centered design, make it more accessible, put best practices out there. But at the same time, IDEO.org works in partnership with a lot of nonprofits, social enterprises. So can you tell me a little bit more about some of the projects you're most proud of and how you make the case that these organizations should be partnering with IDEO in addition to kind of just the broader material and human-centered design you're putting out there?
Yeah, absolutely. I think IDEO has in its history always believed that the more we put out about human-centered design and design thinking, the more of a market there will actually be for our services. So it actually has sort of the inverse effect that you might think it would have, that actually people want to work with us more once they sort of have a taste of it. And I think partially it's because it's hard. I mean, it's not always easy to do, especially for the first time, and I think the resources are a great guide to sort of get a taste and to get your feet wet a little bit, but that in order to do it really effectively, I think having professional designers is pretty critical.
And then we were talking earlier about how it's not just the importance of the approach, but the impact the approach can have. So can you just give us one example of, here's a project, because of this human-centered design approach, this kind of impact resulted, where otherwise it would not have?
So we've been working with Marie Stopes for the past few years in both Zambia and Kenya, and we've been working with them to be able to redesign their services to really appeal to young women and to provide contraception and reproductive health to young unmarried women primarily who are seeking those services. And so with Marie Stopes, they had asked us to really help them understand the young women who they were not as well connected with. And we ended up designing a few things. We designed a communication campaign for outreach to the young women. We designed a peer outreach program for young women to be organizing events and organizing groups and connecting with other young women in their community to encourage them to seek reproductive health services. And then we designed the clinic experience and the service delivery model itself as well, so that when the young women entered the clinic, they would have a better experience. And so with that, Marie Stopes in their individual clinics in Zambia were seeing, 0 to 2 young women a day prior to this engagement and prior to this design. Afterwards, they're seeing about a dozen young women a day. So they're seeing, really significant increase. About 83% of the women who have come in, we've seen about 6,000 women or so in Zambia now. About 83% of them have actually gotten contraceptive services, and about 53 have gone for second or third visits. So really large increases in what we've seen as participation of young women in Marie Stopes programs as a result of going through a human-centered design approach.